Barbara Melchert, and I'm from the Department of Molecular Pharmacology of the University of Groningen. Today's date is March 30th, 2020, and this is a recorded class for the course Pathology and Immunology for first-year pharmacy students. And this class will be about lung tumors. I've shown this picture before in one of the other classes to show you that lung diseases are an important cause of mortality worldwide. And on this graph you can see that lung cancers cause a lot of deaths worldwide. 80% of those are caused by smoking, and of course air pollution is increasing in prevalence. Can also cause lung tumors. 70% of the lung tumors develop in the bronchi, so in the airways, and 30% more peripheral or in the alveoli. And the problem with lung tumors is that there are no early symptoms. So by the time you usually discover the disease, it's already in a late stage. And symptoms then are coughing caused by an infection distal of the tumor, because the tumor prevents the mucus from being removed from the airways, so bacteria can grow in that mucus and cause an infection. Or the tumor can cause an obstruction of the airway and thereby cause wheezing and shortness of breath. Or it could push on something else which causes pain. These are usually the symptoms that people develop when the tumor becomes bigger. It's one of the most deadly tumors because it's usually discovered in such a late stage, and there are different types. So 80% of the tumors in the lung are called non-small cell tumors, and 20% are small cell lung tumors. The 80% of the non-small cell tumors can be divided into different types again. 10% are large cell carcinomas, 20% adenocarcinomas, and most of them are actually squamous cell carcinomas. So how do you develop these tumors in your lungs? Usually we call them lung carcinoma, and carcinoma means derived from epithelial cells. So the epithelial cells are the cells that become tumorous. Here you can see a normal epithelium covering an airway with basal cells, with ciliated epithelial cells, with some goblet cells in there as well. And since most of the tumors develop when smoking, I'll keep that as the example. So when you smoke, these cells are constantly damaged, and so the epithelium will change to protect yourself against that constant damage. So first of all, you get mucus metaplasia. So that means that metaplasia means change into. So the epithelium will change into a mucus epithelium. So a lot of mucus cells will develop to produce lots of mucus to protect yourself from that constant smoke inhalation. So that's why smokers also tend to cough a lot, because they make lots of mucus. When that is not enough anymore, you get squamous metaplasia, and that is replacement of the ciliated epithelium by a squamous epithelium that can handle the smoke stress better. So these squamous epithelial cells are flatter, they don't have cilia, and they're much better at withstanding smoke damage. Here again, normal epithelium with the cilia. When smoking you get metaplasia, so you get squamous epithelium covering the airways, and if that smoke is continuously also affecting those squamous epithelial cells, these epithelial cells can change, their DNA changes, and you get dysplasia. So there is a change of these epithelial cells become more immature because they have to divide so often, and there's so much damage to the DNA because of the smoking that they become different, and that can then develop into a neoplasia, which means new growth, when the DNA is changed in such a way that these cells become cancer cells and start growing uncontrollably. And here you can see what it looks like under a microscope. This part of the airway, so this is an airway, this is the basement membrane, this is the air part, here the lung tissue itself. So these epithelial cells are still quite normal. You see the cilia still on top of that. It appears to be a pseudostratified epithelium with 2 layers. And then here you see that the epithelium changes. It becomes a big blob mass of squamous epithelial cells. So where do these tumors mostly develop? Well, the small cell carcinomas mostly develop in the bigger airways, while the non-small cell carcinomas have different places. Squamous carcinomas mostly in the bigger airways, of course, because that's where the epithelium, the ciliated epithelium, is replaced by squamous epithelium. Adenocarcinomas are mostly in peripheral lung tissue, and the large cell carcinomas often in the outer edges of the lung. Of course, also for this lung disease there are sex differences. Most of the people that develop lung cancer are older and have been smoking for a very long time. But what is often seen is that when women develop lung cancer, they're often younger. So also pointing at the fact that they tend to be more sensitive to the effects of smoking. So they develop disease earlier. So they develop COPD earlier and develop lung cancers earlier. And the thought is that somehow estrogen stimulates the growth of lung tumors. And the increased sensitivity for cigarette smoke here again shown. These are the smoking numbers. So in the 50s, 60s and 70s, men smoked more than women. So they also had developed lung cancer more often. That's the dotted line. But in time, this incidence of smoking decreases, and you see that the incidence of lung cancer decreases in men. Women tended to smoke less, but now, since the 70s, the number of women and men smoking is roughly similar. But also women are starting to smoke less, but their incidence of lung cancer is not decreasing, it's actually increasing, showing that they seem to be more sensitive to the effects of smoking. Also, there's a special group of people that develop lung cancer when they've never smoked, and these non-smokers are more often women. There is some good news for women, however. They tend to respond better to treatment and have a better prognosis than men. So how do you actually treat these lung tumors? Well, for non-small cell carcinoma, the earlier you get the diagnosis, the better the diagnosis, and the only treatment is just getting the tumor out, so surgical treatment. And then the prognosis is dependent on the stage of the disease. So the earlier you find it, the better you're off. Small cell carcinoma is slightly different. It has a very poor prognosis independent of the disease stage because it metastasizes easily, and it's also often neuroendocrine active. It means that it produces hormones, and you get endocrine disturbances that really affect quality of life. and prognosis for these patients. It is susceptible to chemotherapy and radiation, so that is the standard treatment for these patients.